Bonsoir à tous. Bonsoir, Monsieur le Président.
Good evening, everyone. Good evening, Mr. President. Good evening, Mr. President. Good evening, everyone. Let me specify that we just took our masks off one moment ago, and we're each 2 meters apart from each other. That way, we're taking no risk of contamination. First of all, Mr. President, 8 months after the beginning of the epidemic in France, the French are worried. Sometimes they feel at a loss because their rules seem contradictory sometimes. Where are we? Where do we stand today? In France, are we at the same level as in mid-March, just before the beginning of lockdown? Have we lost control of the epidemic?
Good evening. We haven't lost control of the epidemic. We are in a situation that is of concern, and it means that we must not be inactive on the one hand, but we mustn't panic either. We have learnt lessons from the first wave. Our country was hard hit by the pandemic, and we have been able to analyze what we did well and what we did less well. But this pandemic hit the whole world, and Europe, of course. We had, during the first wave, 30,000 victims, and since then, 2,000 supplementary victims. And this virus, which we've known since the beginning of the year and that's been hitting us for 8 months, has come back. We are now in this second wave. And the virus has been coming back everywhere in Europe. Right now, Germany is also imposing more restrictive measures. 3 weeks ago, we were in a worrying situation. The Netherlands, Spain are also in a very worrying situation, with even a larger number of cases compared to their population than us, and have also taken more restrictive measures. So the virus is back, and it's spreading everywhere in Europe and in our country. But I think it's important from the outset of our discussion to say exactly what we know about this virus. We know that it is deadly. The WHO reminded us that 0.06% of people who are touched by it are killed. We've had 32,000 victims in France. It kills mostly elderly people. It's true that 90% of the people who have died in France of the virus were over 65 years of age. And it usually hits those who suffer from other conditions, diabetes, hypertension, obesity. But you can also not have any other conditions and die of COVID. It is a very unfair illness because it hits the poorest and the more vulnerable in our societies. But having said this, this virus hits people of all ages, and there are serious forms of the virus at any age. At this very moment, half of the people who are in IC units with COVID are under 65. Right now, there are hundreds and thousands of fellow French men and women who have had this virus and who've recovered afterwards, but they've lost their sense of smell, they've lost their sense of taste. They will have lesions in their lungs, and sometimes they'll have consequences for their brain, their heart, and so on, which we don't understand yet. We don't understand the consequences. So this virus is serious, and it is deadly for many people. And we are now in a phase where we have to react. Every day we are measuring things better. We're doing between 1.3 to 1.4 million tests per week. And right now we have counted 20,000 extra cases per day. For the past few days, we've had 200 people entering into the IC intensive care units every day. And over 40% of the IC intensive care units are taken up by COVID patients, which means that our ICUs are now under a pressure that cannot be sustained. And what you need to understand is that the difference between the moment that I'm speaking to you now and what was the situation in March, April, is that we know how the virus functions. And so we haven't lost control. But our emergency services, our hospital services are in a situation that is more worrisome than back in March. Because when we decided to impose a lockdown, the virus was spreading in the eastern region of France and in the Paris area. And once we imposed a lockdown, it didn't spread much further. And so we were able to isolate people, and we were also able to reprogram surgeries and elective procedures for weeks in order to liberate spaces in hospitals. But today, the virus is present everywhere in France. So there's no reserve today our healthcare workers are suffering from fatigue because they were on the front lines during the first wave, and then they had to reschedule all the other operations during the summer, and now they're hit by the second wave. So there are no extra hidden beds, and that's why we have to impose stricter measures in order to be able to take control fully of this disease.
We'll come to that in just a moment to talk about ICU beds. The French spent many weeks in lockdown. We see the resurgence, which seems to be going on and on. You've got several options, either a renewed lockdown, a lockdown like some others have done in Europe, certain cities in lockdown, or curfew. For several days, people have said you're opting for a curfew. Is that true?
Yes. But first of all, I'd like to explain to you why we're doing all of this. It's been said, if we have to react, it's because we have to slow the spread of the virus. First of all, to protect others. Sometimes ourselves. It depends who's speaking, but the elderly, the more vulnerable, and the poorer members of our society. That's our first goal. Secondly, we have to protect our health system and our healthcare workers. And then I'm speaking for all of our fellow citizens who are listening to us today, because we have heard in the last weeks people say, I'm not concerned by this, don't take away my freedom, I have the right to be infected. But it's not true, because we are a nation of citizens, and we're all linked together. And so even if I don't want to be altruistic, to slow the virus is also protecting my health, because if I don't slow the virus, if I suffer from another illness tomorrow, or if my brother, my sister, my mother, my father suffer an illness tomorrow, no one will be there to help them. That is our goal, to protect others. And our goal is to slow the virus and to make sure that these 20,000 cases per day, that this number is brought down to 2,000-3,000 cases per day, because that is a figure that we can control. 200 daily admissions to ICUs has to also be limited, so that we can lower the share of COVID patients in ICUs to about 70%, because that would be a number that can be controlled. So we do not want to impose a new lockdown. But what we want to reduce is contact situations, moments when we're off our guard, when we're spending time with people who are not from our household or our families, moments for friendship, for social interaction. That's why this is quite cruel in our management of the illness, because these moments of conviviality bring us too close together, and that's when we can infect each other. So this curfew is a measure that is relevant, and we saw its relevance in Guyana. What we did in Guyana allowed us to slow down the spread of the virus. But slowing down these social relationships allowed us to be efficient in Mayenne, it allowed us to be efficient in Guadeloupe, which was very hard hit, and this worked. And they've managed to slow the spread of the virus. So the decision that we've taken is that of a curfew that will be applied in the Ile-de-France, the Greater Paris area, where the virus is spreading very actively, and in several large cities, 8 cities, which I will name. The cities of Grenoble, Lille, Lyon, Aix-Marseille, Montpellier, Rouen, Saint-Étienne, and Toulouse. The local representatives of these cities were contacted in order to organize this curfew. The curfew will last from 9 p.m. to 6 a.m. and it will start on Saturday at 0 hours.
How long will it last?
Well, the government has decided it will last for up to 4 weeks, and then we will see if it will be prolonged till the 1st of December. The analysis that we are doing is that if in the next 6 weeks we can, in those active circulation zones, see that the measures that have been imposed in the last few weeks, because all these cities have seen measures such as closed bars and other areas that have seen different constraints. If during these 6 weeks we maintain the curfew, and if we're all collectively responsible, if we do show that we're committed to reduce our social contacts, then I believe that we will be able to progressively reopen. I'm very careful here because our experience shows us that we can't be sure, but 6 weeks seems to be a good horizon. But I need everyone to understand the goal, the objective. We need to be able to keep having economic activity, to keep being able to work. Schools, high schools, universities have to be open and have to function properly. Our fellow citizens have to be able to work normally and have a social life, but this social life has to be reduced. And what we want to capture through this curfew measure is all the things that have stimulated the spread of the virus in these regions, meaning private meetings, parties, birthdays, moments of conviviality where there's 50, 60 people at festive gatherings, because these are factors that drive the virus.
Just to be clear and specific, at 9 p.m. in all those cities, we're talking about 20 million people approximately, all movies, theaters, restaurants, bars will be emptied. Everyone will be at home or on the way home.
They will close at that time, yes. But I think you need a lot of common sense with this and a very localized approach, because, of course, all these establishments will have to close at 9 p.m., but it depends on your specific situation. If you live next to the restaurant, you can go out at 9 o'clock. If it takes you half an hour, you'll have to organize your time to leave the restaurant at 8:30 instead of 9 o'clock. And there'll also be local consultations because the situations are different around the country. The organization of our lives is different in Grenoble, Saint-Étienne, or Paris.
9 p.m., this is important. There are knock-on effects for restaurants, bars that are already hard hit by the previous measures, theaters, movie houses, and so forth. Will there be new arrangements to assist these stores, these operations?
Yes, you are absolutely right. We will try to help as much as possible, help theaters and cinemas, to help them to reprogram and to organize things so that people can go there earlier. I'm saying this because in many establishments, in restaurants and theaters and cinemas, we have set up rules together that mean that people are very protected there, because we reduce the number of people who can sit at one table in a restaurant, because we have health protocols that are very efficient in cinemas as well as theaters, operas and so on and so forth. So we will try and reprogram things to end a bit earlier, but of course there will be economic consequences.
Restaurants will have to close.
For example, in Paris, we know that if we impose a curfew at 9 p.m., there are restaurants who will decide to close. Now, we'll talk about economics, of course, but fully paid furlough leave will be reactivated for all these different sectors, for the hotel industry, restaurants, events, sport, culture, and so on. So up to 90% of basic salary will be guaranteed by the state. They will receive their full payment. We have preferential systems that have been implemented. And from Friday, in each of the cities, we will start consultations with all the different professions that are impacted by these measures. And we will improve the economic response with these businesses. I'm thinking of restaurant owners because they've made amazing efforts. And restaurants are part of the French art de vivre. And they will have to close because their overheads will be too high.
How can we improve the situation?
So we will set up extra assistance systems because, quite clearly, I do not want our self-employed workers, our small and medium companies to go bankrupt because of this curfew, like happened during the lockdown. In economic life means that we know that there are consequences in certain sectors. But we will have extra assistance systems in place to help support them economically in the cities where the curfew will be will impact them. We have to do more for the independent workers with the mechanisms that I've mentioned. For self-employed workers, we have extended the assistance to 50 salary companies and increased the financial support. This will have to be increased, of course. A restaurant owner in Paris who has made all the efforts to be able to respect these rules, if he can't stay open, we will help him.
Could we come back to restrictions on individual freedom that are going to be placed on us? Are there going to be exceptions, waivers, exemptions? Apparently, I won't be able to stroll around at 9:15 without some sort of proof that I'm allowed to do so. Is that true? Are you going to have to apply for this on your cell phone? What's going to happen?
Yes, exactly.
As from Saturday.
Yes, from Saturday, the work that will be done in the next 2 days. Tomorrow, the Prime Minister, with the ministers, will have a press conference to give you the details, but very broadly speaking, we will continue to work. Our economy needs this, our society needs this, our children need to keep going to school. I am very happy that we were one of the first European countries to reopen our schools, and I'd like to thank all the teachers who've done an amazing work in this direction. We have to keep going to work in all sectors in order to work our industries, our services, and our country needs this to keep morale up, and we need to do this in order to finance the rest of this mechanism. And so for all the people who finish work after 9 p.m. or who work at night, there will, of course, be exceptions. For those who have emergencies, health emergencies, for example, there will be authorization. So there will be cases that we will define, things that we will define thanks to common sense. There won't be a ban for moving around at night, but there will be a strict limit for compelling reasons. This means that you won't be able to go to restaurants, you won't be able to leave the restaurant after 9 p.m., you won't be able to go visit friends after 9 p.m., you won't be able to go out and party, because that's where we know that the virus spreads the most.
Who will ensure compliance with curfew? The police? Will there be the military around?
No. There will be controls, and I'd like to thank our police officers for doing this from the beginning, and there will be fines, as there already are. For
how much will the fine be?
So it will be a fine of 135 euros, which is already the fine that's in place for people who do not wear their mask in public. Let me remind you of this. And if you do it a second time, the fine goes up to 1,500 euros.
Using all of our police force?
We will mobilize them proportionately, and this will be done locally. But what I also hope and what I expect from each and every one of us is that, like we did during the lockdown, everyone should be conscious of the risks and the issues at stake. During the lockdown, we were one of the countries that best respected the lockdown measures. It was very difficult, but the French people were exemplary because they understood that this was something that they were doing to protect the most vulnerable people and our healthcare workers, and we respected these rules better than other countries. We can see this very clearly in all the figures. And so I'm expecting that each and every one of us, in the areas that are concerned, that we respect these measures. The figures are transparent, we're sharing them, you can see them, and we need these measures. And if in 2 weeks or 3 weeks we don't want to reimpose even stricter measures, we have to respect these measures today. So I really believe in the responsibility of every citizen, but of course there will be controls.
And yet the report you're mentioning talks about mistreating people and making them like children, treating them like children. But is a curfew the same thing?
But that's why we're trying to collectively get better. I think we must all, and that's what we've been trying to do these last weeks, we're all the actors of this war against this virus and of our success. In some places, if we want to be faster, be more radical, we need to have common rules. And to set up rules is not treating people like children. It means telling responsible citizens we are imposing rules because we need to collectively respect these rules, because otherwise we will not have a strong enough impact. And all our neighbors are doing this. In Germany, there are 5,000 to 6,000 cases a day, and yet we have 20,000 cases, but they're also taking measures.
She's more cautious, and fewer deaths as well.
And I'm not talking about infantilizing people, treating them like children. We're taking measures that are not disproportionate. We are taking measures that are proportionate when you take into account the risk that we're dealing with. And when we're talking about mortality in France, if we're looking at in longer term, 2-3 years, the difference between France and Germany isn't that big.
Practical question: where you have these curfews, what about mass transit? If you're taking a train from Paris, from Lille to Paris, and you arrive at 9:15, what about taking a cab when you get off the train? What's going to happen?
The public transportation will be mobilized as it was during the lockdown. There won't be less public transport, which is important because people who keep working at night or very early in the morning, they have to be able to travel, and they're traveling for compelling reasons. We also haven't decided not to reduce transport between the different regions, because once again, it's a choice not to treat people like children, but to give them the responsibility. So we're not going to stop people from traveling from one region to another or to stop them from going on holiday, but we will ask them to respect rules of citizenship, of civil behavior.
Some people have a hard time understanding that. The vacation period that's coming right now is a time for meeting with family members, youngsters meeting with grandparents. Isn't there a risk during the holiday period, allowing the holidays and asking people to go to the holidays? The tourism minister asked people to go on vacation, and it's a risk. Some people will come from various regions and go from the regions to the big cities.
We know that when people are in open spaces, out in the fresh air, we know that when people are in places where you can go out, it's easier to fight against the virus. So to ask people to stay home in an apartment and not to go on holiday somewhere, that would be a disproportionate reaction.
So some people will be leaving the cities.
Yes, look, it's kind of what we saw at the beginning of the lockdown. But did the virus spread throughout the country? No. But what we're saying very clearly, what I'm saying today to my fellow citizens, is that if you go to a rented apartment or to your summer home, you have to respect the rules just like they would at home. You still have to take the same precautions. And above all, if you want to meet up with your family members, and this is just common sense, I'm sharing these rules with all of you. We are not going to regulate their lives. We're not going to stop them from going on holiday. That would be treating them like children. So I'm saying you can go on holiday, because there would be a disproportionate reaction to stop you from doing that. But if you're visiting your family, if you're going to visit your grandparents, if you're visiting members of your family who are fragile, it is imperative to respect the rules. So that means that even within your family, you need to wear your mask if you haven't been tested, because if you wear a mask, you're protecting others. So you should wear a mask if you're less than a meter away from someone. You have to keep your distance from others, and having a walk outside is a good idea, but self-eye-fillecting or having gestures that are not limited is not adapted to the situation.
Where you require mask wearing everywhere, even where there's little virus circulating?
So if you take a step back, I've just said what we are going to do, providing the Parliament votes for this in the 6 weeks to come, in the areas where the virus is spreading the fastest. A curfew with an economic assistance that will be exceptional and support, and we will keep working, and it's really important. We will keep working in all these cities and regions. Associations will keep working to look after the most precarious people in society. Public services will continue working. In the rest of the country, what do we have to do? What we have to do is we need to remobilize collectively. I know that a lot of effort has been made by our fellow citizens, but I must state the rules that will be applied everywhere. These are simple gestures that have to be kept within the family and everywhere in France. Keep your distance, more than a meter between people. Of course, with the person you're living with every day of the week, of course, there is an undeniable proximity that you can't change. But if you're with other members of your family, your friends, keep this distance. Wash your hands regularly with hand sanitizer or soap. Wear a mask as much as possible. There are places where this is enforced by law. There are rules that are imposed in certain areas, and we're not going to change them. And when you're indoors and you can't respect these rules, even in private meetings, you should wear a mask as much as possible. This is a form of self-discipline, of a reflex that you need to adopt. It's a recommendation I'm sharing with you. But if you want to reduce the risk of infecting others, you should take these precautions, even with your friends and family. And for everyone in France, you need to air things out regularly. 10 minutes 3 times a day. You should air rooms out. There are protocols in schools and in other establishments that have been set up. And we need to also respect the rule of 6 in restaurants. And again, I'd like to thank our restaurant industry. No more than 6 people at one table. And so as much as possible in our personal life, we have to do the same thing. If there's 7 or 8, 9, 10 people in our family, of course, we'll have to keep having a normal family life. You have to be guided by common sense. But if you're inviting friends, there shouldn't be more than 6 people on a table.
What about
It's a rule of 6. It's a common sense rule that you need to apply to yourself, because it's something that protects us, and it will help us to slow down the virus in the whole of France. So you can see everywhere in the country these rules, and I'm agreeing to what you said, these are not rules that we're going to enshrine in decrees and protocols. I'd like every citizen to take ownership of these rules, to fully take ownership of them.
Including young people. I mentioned young people. We get the impression the curfew is really targeting younger people who go out, who party.
Yes, it's tough. It's tough to be 20 years old in 2020. It is tough. So I'm not going to preach to our youth, because it is they who are actually going through a terrible sacrifice. Exams that have been cancelled, difficult to find training, difficult to find a first job. That's why we have mobilized our efforts so much to create new training programs, to reopen positions, to create positions in schools and post-baccalaureate training. We have developed apprenticeships massively to help, and by helping companies so that they can provide apprenticeships. And so we've financed companies much more so that youth can find jobs and apprenticeships. And we'll do this for young people. But it's normal. When you're young, you have friends, you do party. So I don't want to make people feel guilty. But for the next weeks and months, I'm not asking people to have fewer friends, but you'll have to make more of an effort to meet smaller groups of people at the same time, and to also try to follow these rules, to protect each other. And I know that this is a huge effort, but the bet that we're taking now, and I'm sharing all the information I have with you, there is this constraint. There are these areas, these cities in France where the spread is so fast that we have to impose this curfew, which will be difficult for entire economic sectors, and it is a huge constraint. For the rest of the country, the more each and every one of us can take ownership of these rules, the more we can succeed. And I'd also like to ask our mayors and our local officials to propose plans to us, because they work with the people on the ground, they have citizens' councils, they've created their own structures and mechanisms. We need to work together with our citizens and with our elected officials. Mayors have to be actors of prevention. They're the ones who know the best how to work with associations and with citizens in order to carry our messages and to protect us better. So that's what we're doing throughout France, and we're limiting big meetings and pursuing the rules we've had since the beginning.
You and the Prime Minister have been saying for a few weeks that the rule henceforth, the rule is remote work, working from home. for most people. What's the percentage? What, 50% of the time, 90%, 100% of the time working from home? And the private sector, you can't step in there. But then there's the government employees. What are you saying to the government employees? Should they be working from home? I'm not putting it that way, really. First of all, working, whether you're talking about working in a company or in a government, municipal service, an association, what have you. You're working in a group, wherever you work. There's a group of people. Working from home, that's one thing you can use intelligently. It's a good tool. It's something that you can really use appropriately. If it's a national rule, well, we had to do it during lockdown. But now, sometimes it makes people feel isolated. Working from home, to be frank, if you've got a second house outside of the town and it's very pleasant, it's nice to work from home. But if you've got a small apartment and you've got your children at home and you're all confined together, it becomes really tough working from home. Plus, you need to be able to talk with your co-workers. So you've got to show common sense. We need the businesses to operate properly. They need to have people at work, at the job. We need to have government services that are open, post offices that are all open.
They won't close again.
We need to have teachers in schools and so forth. So yes, everyone has to be present as much as possible. But whenever possible, when it's possible, if you're in an office that doesn't receive the public, or if you're in a business where it's possible, then yes, to the degree possible, and it seems to be negotiated at the ground level, we would ask people, when it's a job where it makes sense, to spend 2-3 days of work a week working from home, because this reduces overall movement of people. We've got to do this with common sense. It's no silver bullet. It has to be negotiated as well. Social partners are right in emphasizing it. It has to be negotiated at the business level. We have to realize we're all together in this. We have to be successful, manage to reduce our contacts that aren't necessary, sometimes partying contacts, but continue to have social lives nonetheless. At work, we protect ourselves with masks and so forth. At school, at the university and high schools, going to associations. That's what life's all about, too.
We have the impression that the situation that you've described that has forced us to impose this curfew was something that could have been predicted and that was already predicted by the Scientific Council, who's already talking about pressure on these cities in July and August, who said that there would be a danger of this virus spreading faster once school started again. And then there was the failure of the testing policy. We waited for the tests for a long time, in May, June, July, and so we don't understand how we could predict the situation before, how we could predict the need for all these tests, but not give ourselves the means to implement these tests in less than 2 days, because it was kind of wasted money.
You're absolutely right. We've encountered true difficulties in this area. We have to be frank about that and say it. Why did we have difficulties? Because we had the resources, and we pretty much kept in line with those resources. We're one of the countries now that does the most testing in Europe.
Not necessarily most efficiently, though.
We can come back to that. That's about testing techniques. We do between 1.2 and 1.4 million tests. And if I look over the last few days, I look at this every single day, clearly, and track this with the ministers. And I'd like to pay tribute to the work the government's done. The Prime Minister, the Minister of Health have been working night and day with their teams out there. We've had difficulties. There's been a great deal of demand, much more demand than we thought.
Because it was free. Because you didn't need a doctor's prescription.
Well, remember, our policy had to do with masks, and there was a question whether this should be free of charge. They were made free of charge for all children, school children who came from low-income families. It was millions of them, millions of masks. But not everybody got this free of charge. This became controversial. Do you think that the solution would have been to make the test
That's
paid
not
for?
what I think, but we should have had the resources to treat all these tests.
I accept completely that we made this test free of charge, because in France we decided there'd be no money obstacle. We've done this from the very beginning of the crisis. We're one of the countries that's given greatest economic and social support.
But because it was free, we could have anticipated this wave.
Maybe because it was free of charge, yes, but I don't think a lot of people just went overboard on this. No, it's mainly because people were worried because there was this virus that was circulating. It was circulating amongst people. We see this pretty much throughout Europe. So I wouldn't blame the testing policy for this. I would just say, and the report says this very well, yes, some of the lead times were too long. Why? Because we didn't have the requisite organization. I'd like to thank all the healthcare workers, public and private, that moved ahead quickly. But we didn't have a big testing center. We have a scattered network. We've got a system that's not accustomed to being put under such pressure. So people had to wait in lines to get tests and wait in line to get the results of the tests. These are technical considerations. You hear a lot about the PCR test. This is an analysis technique. What are we going to do? We're going to change things. And be forward-looking for the fellow citizens on this. For 6 weeks, there'll be a curfew in the major metropolitan areas and in Greater Paris. We're mobilizing throughout the country so that we can win this war. After that, gradually, we're going toward a strategy whereby throughout the country we'll be testing, alerting, and protecting. That'll be the cornerstone to our policy. We'll be ramping up in November, December. We're talking about living with the virus up until the summer of 2021 at the least. That's what the scientists tell us. So if we don't want to be ups and downs, starts and stops, we have to be better at tracking the virus. That's why I say we've got to manage to bring down the number of contaminations per day to 3,000 to 5,000 rather than 20,000 currently. So the first pillar is testing. We've got an innovation in recent days recognized by the WHO, the High Authority for Health. It's the antigen test. You'll still have to do the sampling in the nose or in the mouth with the swab. We know about this now. And then it takes 15 to 30 minutes, though, to get the results. It's faster. We can do this in pharmacies, other locations. So there'll be many other areas to be tested, not just test laboratories. This will be a major change. Next, we're developing techniques to analyze much faster and more tests at the same time. PCR method. We're also continuing innovation, not just in France, throughout the world, to move towards self-tests, so you can use saliva or possibly a pinprick, and you can test yourself. You have pregnancy tests that are similar. So we're going to move toward that strategy. We rolled out in upcoming weeks. So we'll be able to further drastically reduce lead times to get results. If there's any hesitation, if you wonder, if you've got a contact or you've got any kind of doubt, you'll be able to get a test and a quick result. The second pillar is alert. If you've been tested and you've got to be able to alert, tell your contacts, people who may have been exposed to you. You may have had dinner with them and spent time with them, may have been at the canteen with them.
Because Stop COVID did not allow us to do this. It was a failure, a total failure. Stop COVID allowed us to alert 993 people.
I wouldn't use that figure and say it was a failure because of that. It didn't work. It was mainly because it wasn't downloaded nearly as much as
2.5 million people
elsewhere.
downloaded it.
In Germany and the UK, there were a lot more downloads. We weren't successful. If we look at our neighbors today, though, the cases they identified using these apps, even in Germany and the UK, very few. So no one has been successful in turning that app into an alert tool for alerts. But we want this to be a tool people can use. For several weeks now, I've been asking the teams to completely revamp things. We need a new app. It's going to be called Everyone Against COVID. We're all together. We're learning from our mistakes.
When will this happen?
Presented in October, and we'll begin ramping up. It'll be an app containing information, first and foremost. How does the virus circulate? Where can you get tested? So you get information, general information, also specific information and local information through the app. People will often consult the application if it gives them info. The UK has been good at doing this. Next, we'll give a manual, an explanation how to use this. People don't want to have to turn it on and off all the time. And if it might not work in Bluetooth or whatever. We'll explain to them very clearly how it's to be used. We'll say to them, if you go to the restaurant, if you go to a restaurant, if you go to a bar once they're opened again, if you go to your friend's house, whenever you're at a time when you're exposed to other people who may not be wearing masks or what have you, you turn on this app, the Everyone Anti-COVID app. At restaurants, cafeterias, hotels, this will be a tool they can use to better track and trace and identify possible outbreaks and tackle these. Thirdly, protection. We need to protect. We've got to be strict on this self-isolation if somebody has the virus, even if they're symptom-free. And we have to make sure that we adapt to this. This is the strategy that we're going to be targeting with our resources so that we'll be successful once we've got fewer cases per day. So there are fewer collective constraints weighing on us, but we can better track this and control it.
One of the lessons learned from this pandemic is that statistically it's the people who are the most, the poorest, who are the most impacted from a health perspective, also economically. Some associations, some charity groups. The head of the CFDT trade union also said that minimum wages and social benefits should be increased.
We will find a response as we did in springtime. First of all, it's entirely true. From a health point of view, I said this earlier, the virus hits more lower-income people. First of all, because people live in smaller apartments. Often there's several generations living together versus when people have more resources and they get bigger apartments and get their own apartments and move out from their parents' homes. Secondly, this crisis is also unequal in other respects. We can say that jobs that were lost tended to be temp jobs. Precarious workers were hardest hit. This is why I accept a strong economic response, and I shouldered this response, was in favor of it. And as I said, in Europe, we're the country that's probably the strongest in this area, that made the most investments, 460 billion euros. We'll continue doing this, as I said, in exceptional fashion. The most precarious people who fall into poverty, we've got to address this, and what we're going to be doing. This is the broadest, most effective arrangement for the recipients of the RSA benefit and APL benefits. This is also especially for youngsters, 18 to 25-year-olds. They'll get exceptional assistance during the next 6-week period of 150 euros plus 100 euros per child. The same thing that we did during the springtime. So ranging from 100 to 450 euros. This is a big uptick. And one very important thing, we mustn't forget our basics, the fundamental points. The basics are to fight poverty by getting people back on the job. The more we unilaterally increase all the various benefits, and you never reduce them again, the more difficult it becomes for people to go back to work. We've observed this. And that's why, a few months ago, I accepted a big increase in special bonus by 200 euros a month to minimum wage workers. So one-time, massive, large-scale benefits versus changing the benefits once and for all. When we talk about these minimum benefits, social benefits, I would also say the minimum benefit for disabled persons and elderly people have increased historically since the beginning of my term in office by around 100 euros per month.
Mr. President, we only have a couple of minutes, and I have a question that many French people are really interested in. The description of the future of the virus that you've presented us with, this epidemic will last at least till next summer, all these cities that will be under curfew all night. It's all rather somber news. Is there any reason for hope?
There are many reasons for hope. If you're clear-sighted, pull together, and you're united. Clear-sighted means you have to realize and understand the information. I work hard at this. We are the first country to ask for this type of report to be drafted, and we've disclosed health and other information very, very regularly. We have to say that in the country of Pasteur and Enlightenment, we've got to stop the ongoing debate on scientific truth and so forth. We've got a scientific council playing an essential role, and they're going to be long-lasting. I would thank their members. We've got some facts. Let's stick to the facts and not change what we think and say every day. We're basing ourselves on the facts, and we can say this is serious, and we can tackle it. The reason for hope is this. We are learning again how to act together as a nation. Gradually, we become accustomed to being a society of free individuals. We are a nation of citizens that stand together. We cannot overcome this if each of us doesn't play his or her role. That's the key. To say this in no uncertain terms, that's my message for this evening. I need each and every one of you. We need each other so that we can find solutions, be inventive, so we can be citizens respecting the rules, of course, for ourselves and for the sake of other people, but most importantly, to reinvent. We'll become a more resilient nation. We'll continue overcoming our challenges. We'll settle the climate transition and climate problems. We'll have a more resilient nation that will produce economy in its country, will produce medicines and so forth. Once again, we'll learn to protect and overcome this crisis as other crises. We'll come out of this stronger because we'll be more united. If I had one single message to our fellow citizens, it's this: we need each other. We will overcome this together.
Well, there you have the last word. Thank you very much for having us here today. Thank you very much.
Thank you. And we will succeed. We will succeed.
A good evening to you all.